Hi, everybody. It's Memorial Day, and it's DocTalk. And my favorite time of the year is beginning now. These really nice long days. That's the biggest change about summer. And after Memorial Day is, of course, when we have about 2 months of really long days. Just so you know, your body loves a lot of daylight, and your health improves. The sunlight gives you plenty of vitamin D, and your immune system reacts to that. Unfortunately, this is the time of the year when I typically end up with a cold or some variant of that, and that's why my voice sounds so congested. And I'm frankly lucky to have a voice today because the last couple of days it's been a little tough. So forgive me for the summer cold, but that gives me an opportunity to talk a little bit about respiratory infections that we get this time of the year. A lot of times those are matched with allergies and allergy problems, and probably a little bit your body reacting to the allergens that are in the air with lots of grasses and flowers and trees, and all of their offspring trying to come out. We as humans react to those. Human beings have allergic problems to something. It's only a question in your life of whether you're going to find what you're allergic to. But our allergic systems work very well to keep us protected from things that are really hazardous. But occasionally they overcome your ability to live very well, and can cause problems. And this time of the year, runny eyes, runny nose, scratchy throat, a little bit of a non-productive cough are kind of common. What that does, though, is set you up so that viruses and occasionally bacteria and other things can infect your mucous membranes and don't get washed away as efficiently because of the allergy problems. And then you end up with a little bit of an illness. So this was not atypical for me at this time of the year to pick up some form of a respiratory virus. Viruses are different than allergic symptoms. They oftentimes will produce a fever, and that feeling that you're all washed out and worn out, and you get sweaty at night, and those things that really manifest as infections rather than simple allergies. And they don't react well to antihistamines, decongestants, and sometimes steroids. And we now have steroids in many ways that people can get that really are able to give them a better life as they work through their allergy season. They can put steroids in their mouth. They can put steroids in their nose. They can ingest steroids and take them so you have a systemic improvement. And occasionally, everybody gets to that stage where you're just miserable with your allergies, and you try the antihistamines. And if they don't work, then you can go up to decongestants. And if they don't work, your doctor can prescribe steroids of varying kinds. And it's good to have that discussion with your doctor about which is best at which time and which should trigger your ability to go to something a little bit stronger. So that's a little bit about allergies that happen this time of the year, particularly right between Easter and Memorial Day. Oftentimes are the really peak season. And when we see a lot of asthma cases in our medic units and in our emergency departments. And we have some people who kind of get into trouble this time of the year and end up in the hospital. So we worry about taking care of those people this time of the year, and everything we can do preventive wise, we try to do. Let's talk about prevention around Memorial Day. This is great family time. It's your celebration of the outdoors. It is typically the first time many of us get into the water, and so we need to talk about water safety. This is the time of the year when we can have people who get in the water who aren't quite prepared for it, or they get in and the little ones follow them into the water. We fill up our pools and other things, and that's really a dangerous time of the year. So water safety this time of the year involves the following. Number one, if you're not a swimmer and you're in water, you really ought to consider at all times wearing a flotation device. And that's a well-fitted flotation device, not a little toy that you wrap around or that the children get into. We're talking about a serious personal flotation device, PFD. Those are available in really cool colors, great designs now, from the little infants through to the older people. And if you're not a great swimmer, if you're swimming in areas that have portions that are over your head, or if you're going to be doing a dangerous thing, which is swimming alone, you really ought to consider at all times having a personal flotation device. When you have kids around water, a very, very consistent behavior has to be for the little children. They have to have a flotation device on if they're going to be anywhere near the water, period. Anywhere near the water, they have a flotation device on. And supervision that is not distracted. They talk this time of year about the people who have one duty, and that is to watch the kids in the pool or the other place where they're going swimming. And that is a dedicated adult who's a good swimmer and perhaps has some other rescue devices around them, whether they're poles or life preservers or other things that are not in any way distracted by the other activities going on at the family reunion or anything else. They have one role, and that is to watch the kids and other individuals around the water. That's really important in lakes and in other places where you can't see to the bottom of the body of water. But even in pools where you can see all the way to the bottom, but the little kids are out there. It's their first experience in around water for the year, and it's frankly the very most dangerous time. You got to put up fences and other barriers to not let the little kids come in. In my career, unfortunately, we've had little kids who wandered out, little kids who found their way around fencing that wasn't adequate to keep them out, and they made their way into pools and had dreadful outcomes. And you talk about ruining the holiday weekend, not only for that year, but for many years to come. It's to suffer an unfortunate drowning episode. So water safety, big event this weekend. Time to set your precedents for how you're going to do things the rest of the summer. And then anything that you can do about getting those little kids all the way down to the infants into water safety training. And they have fabulous ways now of teaching little kids how to even though thrown into the water fully clothed, they can flip onto their backs and save their lives. And so any kind of water safety training, eventually swim instructions and other things for the older kids, really important. Commit to doing that this summer for your entire family, all the way down to the little ones. Number two, safety for this Memorial Day weekend is safety around fires and burn safety. We have a prevalence this weekend and then that 6-week period that gets us to the 4th of July, where people get into trouble with fires, fireworks, firecrackers, etc. What are the safety points? Number one, use the firecrackers only as they're designed. One device at a time with an adult in a safe area that can't catch on fire, that doesn't have little kids wandering through it, that is set up so that if you're shooting something off, is in a safe area that won't catch on fire and can't misfire and go into the crowd, etc. Number two, gasoline fumes burn, not gasoline. Gasoline fumes burn. They expand once you leave gasoline out of a container. The fumes expand, and when you light something around gasoline fumes, they ignite. If you happen to be in that zone, you're on fire too. If those fumes have embedded themselves in and around your skin, you're on fire. You can flash, or you can literally catch on fire. The same thing happens for your propane or your natural gas. If that forms a cloud around you, that is dangerous to you, and you can ignite those fumes around you, and then you can be on fire or you can have been burnt. All of that goes to say, all of those flammable gases that we use this time of the year have dramatic impacts on human beings, and you don't want to be one of them. Firecrackers, sparklers are really cool, but when you put a bunch of them together, it's like lighting a torch. And they multiply their effect exponentially. And so a bunch of sparklers, one adult has decided to ignite 5 of them and then pretend you're going to hand them out to the kids individually. It doesn't happen that way. The 5 of them going off together is a torch in your hand and will burn you significantly. And then you can't hold on to a torch. And so you drop them, and then the sparklers are going everywhere and have ignited at a higher temperature and are burning other people as well. That has happened. When we try to rig together multiple firecrackers to make a bigger bang, they don't ignite appropriately and simultaneously, and one of them shoots another lit one off, and it's underneath the child, or it's still in your hand. That is not a good thing for you. And firecrackers every year this time of the year, we have people have unfortunate events with firecrackers, permanent disabling injuries, eyes, face, hands. Most appropriate, also can set your clothing on fire, and then you end up with burns to the torso of your body. So I want a very important reminder. I'm going to go back to the gases again. The most dangerous of all of the gases is propane. So we get our propane tanks out. Propane, by definition, is heavier than air. So when you release the valve of any kind, that gas, propane gas, goes out, and then it sinks. And it sinks and finds the lowest area where it can collect, and then any ignition source that it can find. It releases its power in a much more explosive fashion than natural gas. Natural gas is the same density as air, and so in many ways it will drift and carry away from you, where propane comes out and sinks. We have fatal propane explosions every year for people who are unaware of the difference between propane and natural gas. And the fact that propane is heavy and it collects in certain areas. And then even unexpectedly, if there's a leak of that material into, let's say, a basement or a sunken area in your garage or yard, and something goes through and ignites it, maybe something like a lawnmower or somebody wanting to light something else, and it lights the propane, it explodes. Which can cause very severe injuries and death. Natural gas also will explode at typically with less of a pool and with less energy. It can ignite and explode with great force at just the exact right mixture. So you have to be careful around that, but not nearly as much as you have to be careful around propane. And then in the world of gasoline and people trying to play games with gasoline, using it to clean up something, and those fumes are just going out across their environment there. Gasoline is something else that many of the components of it will sink a little bit, and it'll find an ignition source somewhere. Don't be using gasoline inside the house, inside the garage, anywhere near a heater device of any type. Be careful in your motor homes and in tents and other places where you're using gasoline, because those fumes can collect and ignite. And again, gasoline, will leach into everything, including into your skin. And when it begins to burn, it will burn your skin very significantly. Also, don't leave gasoline up against your body. If you have spilled gasoline on something and it sits up against your body, it begins to erode through your skin as in a chemical burn, and it can produce a full thickness burn if you are laying in wet gasoline for some period of time. And so we have those things happen occasionally with incidents like motorcycle crashes or mini bike crashes or ATV crashes, where the cap is not on perfectly tight, the gasoline leaks out, and somebody is trapped in a layer of gasoline underneath them. Not only is it an ignition risk and a potential burn, but that liquid alone is beginning to separate your skin layers and it does so over time at a deeper and deeper level. And so those are things we worry about with gasoline. Finally, we'll talk about, since we last had our doc talk, the end of the public health emergency known as COVID. So we've been 3 years through the pandemic. As of the middle of May, so a couple weeks ago, we ended the public health emergency in this country. What does that mean for you? A couple of things. Number one, the federal government paying for diagnosis and testing, treatment and vaccinations is beginning to go away. Many places still have COVID tests available, and they are free. They were paid for by you as a taxpayer and by the federal government. But at the point where those tests are all gone, we will no longer have free testing for COVID, and you'll have to pay for it. Number two, you as a taxpayer paid for vaccines. As long as those vaccines that were paid for by the federal government are still available in local areas, in state reservoirs, et cetera, those will be free. But at some point, it will cost you or your insurance company for you to get vaccinated. The vaccination series are still good. And those vaccinations coming into the fall, we will hear about the need for bivalent vaccination for people at risk this fall for COVID. So you can prepare for that. Number three, what if you do get COVID and we still have COVID at very low numbers in our hospitals, in our nursing homes, in our rehab facilities, and that COVID still has some treatments available. And in many cases, those treatments were made available by federal dollars, your tax dollars at work, paying for those treatments. We are really now at the point where treatment for infection is likely to cost you money, either out of your pocket or from your insurance company or some combination of the two. So with the end of the public health emergency, you should be aware the things that were free over the last 3 years may now cost you money, and you may have a little more difficulty getting to them. With that, we're going to talk less about COVID over the course of the summer, thank goodness. Love this warm time of the year. Take advantage of it, get outside, get healthy, acclimate at this time of the year to the warmer temperatures. So you can only acclimate by actually being out in that nice warm temperature environment. Let your sweat system come up to speed. Plan your athletic activities so that you're building up to them a little bit at a time, over the course of days to weeks. Don't expect to live in an air-conditioned life and then be able to go outside and do significant strenuous activity and not really feel the impact of it. This time of the year, you have to hydrate a little bit more, make sure your diet stays good so that you can retain more of that fluid inside of you and stay healthy. And then the final thing is careful around the foods laying outside on Memorial Day weekend. Going out on those picnics, be really careful about laying that food out in the sun and then coming back a couple hours later and eating it. So use your cooling systems, shield that food, make sure you don't end up with a nice food poisoning case to ruin your holiday. So it's Memorial Day. It's a great time of the year. We've been waiting for this. We're out of the public health emergency and pandemic. We're enjoying activities together. We are cruising and airports and traveling to see each other and having a wonderful time. I hope it's that way for you the entire summer. Take care. From DocTalk, have a happy Memorial Day weekend. Thanks.